Hello everyone and welcome back to the channel. In today's video, we are going to talk about something very important for the new mothers and families. Many first-time parents, they feel nervous because no one tells them what to expect after the baby is born. There's a lot of focus on pregnancy and labor, but very little clear information about what happens right after the delivery, right after when the baby comes out. So in this video, I'm going to explain step by step what to expect in simple, practical terms. But before we start, let me make this clear. Every hospital, they have a slightly different protocol after the delivery. So especially when it comes to the rooming in or skin to skin contact or discharging you from the hospital, each hospital differs in their protocol. Some hospitals, they allow the baby to stay with you all the time, but some others, they have some nursery hours. So you have to discuss all of these with your gynecologist even before the delivery while you plan for your birth. If you haven't watched the entire video on how to choose the right hospital, please watch it, linking it right here, or you can find it in the description below. Go check that out. I hope you'll get clarity on how to choose the hospital and what all questions that you can ask so that you are prepared better. Immediately after the baby is born, the doctor or nurse, they will check if your baby is breathing properly and everything is fine. If everything is okay, then they will place your baby on your chest, and it's called as skin to skin contact. This is very important for the recovery of the mother and for the baby as well. During this time, the baby might try to move towards the breast to start feeding. Now, if this doesn't happen, don't worry. For some people, it doesn't happen immediately. Every baby is different and the timing can be different. You will still feel some mild contractions in your belly because your body needs to push out the placenta. So the placenta is the organ that help nourish your baby throughout this pregnancy. And the pushing out the placenta happens usually within 15 to 30 minutes right after the birth. So after the delivery, the doctors will check if your bleeding is normal and if your uterus is shrinking back properly. If you had stitches in the vagina or from a C-section, they'll make sure everything is fine there. You'll also notice bleeding like heavy period. It's called as lochia, and this is normal. It may continue actually for a few weeks and it will reduce gradually. You might also feel cramping in the lower belly, especially when you breastfeed. This happens because breastfeeding, it releases a hormone that helps your uterus shrink back to its normal size. It's normal to feel tired, sore, or even slightly dizzy in the first few hours after the delivery. Your body just went through a huge process and now it needs some time to rest and recover. Let's talk about the baby after birth now. Right after birth, the baby looks a little strange. Maybe their head looks cone-shaped or skin looks a little bluish or wrinkled. This is normal and that will improve in the next few hours, or for some babies it takes days. The baby will usually cry, which is a good sign. Doctors will check if the baby is breathing properly, check the temperature, heart rate, and also all the reflexes using a score. It's called as Apgar score. In the first few hours, the baby may sleep a lot because they are also tired after the process, or they'll be very alert. The first poop, it's actually black and it's sticky. It's called as meconium. It's completely normal. Feeding usually starts within the first hour if that is possible. In the beginning, your body will produce a special kind of milk. It's called as colostrum. It's usually thick and yellowish, but in some cases, especially if you have received IV fluids during the labor, it might appear thin or watery. It's also completely normal. Quality of the colostrum, it doesn't change. It's all packed with essential nutrients and antibodies that help your baby build the immunity and protect them from all kinds of infections. So whether it's thick or thin, it's perfect for your baby. Don't worry if you feel like your baby is feeding constantly. Newborns have small stomachs and it needs to feed every 1.5 to 2 hours, even during the night. So babies also sleep a lot, like in the first 24 hours, sometimes up to like 18 to 20 hours a day, but in short stretches. This can feel very tiring, especially for the mother. So it's very important to take rest whenever possible. Okay, recovery and emotions in the next 2 to 3 days are like roller coaster. You will notice changes in your body. Your breast may feel like fuller or heavier as the milk increases. Bleeding will continue for the next few days and it usually reduces after that. If you had stitches, it will feel sore, but that will heal over time. Some mothers, they feel very emotional during this time. This is due to the hormone changes. You might feel like crying without any reason, or you might feel confused or overwhelmed. It's called as baby blues and it usually gets better within a week. But if it lasts longer or if it feels too heavy, it's important to talk to a professional about this. Your baby will also have a few routine tests during this time, like hearing test, weight check, and physical exam. Doctors and nurses, they will guide you about feeding, burping, diaper care, and all of these. In the first few days after delivery, try to keep your baby as close to you as much as possible. Do a lot of skin to skin. This helps you become more and more familiar with your baby's hunger, sleeping cues, and makes the feeding and bonding easier. It doesn't mean that it's not okay to ask help. Ask for help whenever it is required, whether it's from your partner, family member, or from the hospital. You don't need to do everything by yourself, especially when your body is still healing. Try to focus on just these three things: feeding your baby, sleeping whenever you can so that your healing becomes easier, and try to recover as easily by doing all these. Everything else like housework, phone calls, or visitors, that can wait. Also, don't forget to drink enough water, eat good nourishing food, and keep your energy up. Rest, it's also just as important as nutrition in your recovery. Even short naps while your baby sleeps can make a big difference. Your baby will also go through big adjustments, like expect frequent feedings, long sleep hours, and different poop patterns in the first 24 to 48 hours. You may experience some emotional ups and downs, which are completely normal due to the hormonal shifts and the mental load of caring for a newborn. But with the right support, proper rest, and realistic expectation, the early days of motherhood, that can feel much more manageable. If you found this helpful, please like, share, and subscribe to the channel. It means a lot. I'll be covering more topics related to newborn care, breastfeeding, and motherhood in upcoming videos. If you have any questions, drop them in the comments. I would love to hear from you.